So I think telemedicine is especially critical nowadays while we're dealing with COVID-19 to keep patients both out of the emergency room and the hospital. So to leave them to leave those places able to deal with the COVID and respiratory patients. So as far as dermatology goes, we can deal with really the vast number of cases by telemedicine and keep those emergency cases certainly out of the ER. But even on a more routine basis, teledermatology especially is so amenable to telemedicine because of photos, and we have really good clinical exam via the photos. And there are many conditions which, if not addressed in a timely fashion, I mean by that within a few weeks to a month, example, skin cancers, for example, certain widespread rashes, um, can really, certain skin infections, of course, can leave the patient in a not so good clinical place, while telemedicine can address that quite simply and quite effectively right through the primary care doctor, as we do in AristaMD. One thing I've experienced while practicing telemedicine in the last month, especially, is just how grateful patients are that we're continuing to look after them. Some of them sound surprised when we contact them to let them know that we're taking care of their skin problems, whether that's directly or through their primary care doctor. But they're very grateful for the care, and also just very caring about all healthcare providers in this environment. And so I think it's really been a very gratifying experience to provide telemedicine to our patients nationwide, really, during this time. And they're surprised by it initially, pleasantly so, and just very, very grateful. So there's really no good reason not to continue, not to provide excellent care to patients throughout the US with telemedicine, and at least for me, through teledermatology.